If I know that foreskin is not a birth defect and nobody wants less penis, would I press the green button?
So, does anyone want less penis?
No way!
I didn't think so. Breaking news to report on efforts to stop legislation in Maine that would take away children's bodily autonomy by using taxpayer funds to essentially encourage and promote circumcision. Bodily autonomy is something you and everyone else has a right to have. And I can finally say you, or those that supported our Maine campaign by donating to it, helped kill this bill. Dead on the table, as they say in the State House. And now children in Maine will be more likely to live their lives with natural, normal, healthy, intact bodies. Something maybe you should have had too, because Mainers realize
nobody wants less penis.
Moving on to New Hampshire, we had two bills in play. One to vastly improve the parental informed consent for circumcision, and another to stop the money for medically unnecessary infant circumcision. The informed consent bill was moved out of the Health Committee for interim study, and the bill to stop insurance money for Medicaid sailed 14-7 out of the same committee, but then unfortunately failed to pass in the House by a very narrow margin of 191 to 184, which means we were just 4 legislators short of passing the House. So I'll break this down on what happened in Maine and New Hampshire and the ongoing struggle over bodily autonomy rights for males and you in these state houses, and why, if you're a male, why you still don't have a right to choose whether or not you can be subjected to medically unnecessary, needless genital cutting. And it was probably done to you because at the time, your parents were inundated with misinformation and therefore manipulated, and you were helpless and couldn't fight back. So let's get going and roll the intro. In Maine, LD 1858, and we're calling it It's Over, and it's foreskin for the win. The bill to throw money at hospital systems for circumcision, and therefore encourage male genital mutilation, died in the appropriations process and was not funded, as was our strategy. This is something you made happen. Maine children will continue to be more likely to retain their healthy, natural, and normal, intact bodies, and not become scarred by genital mutilation, unlike many of their American counterparts in other states. And these people will then have to live their entire adult lives with incomplete bodies and changed sexual function. If you want more background on this bill, watch my prior video, 6 Women in Maine Obsessed with Cutting Your Penis. Link in the description below. The bill allegedly had its origin from a situation in Maine where, from what I was told, some guy needed a medically necessary circumcision. I think he had a torn foreskin. And someone at Maine Health, a big health system up there, convinced the people on the health committee that if more babies were cut, then less adults might need a circumcision. And Maine Health might have more revenues. But it's like, yeah, let's make every baby suffer with a medically unnecessary circumcision to try to prevent one person's issue. But I digress. I suppose Maine Health CEO Andrew Mueller and his CFO needed those revenues to pay for their $1.2 million annual salaries. We became involved with this bill in the summer of 2023. The bill had left the Health Committee and was quickly passed by the House with the non-vote procedure called under the hammer, which means no member objected or called for a vote, so it was automatically passed. So that was a situation I had to dig ourselves out of when we became involved. The bill only needed funding and the governor's signature. We hired super lobbyist Sarah Vanderwood of Main Street Solutions to represent us. Sarah helped us to intervene with the Appropriations Committee by having meetings with most of the members on that committee in Portland and Augusta. We also met with the Speaker of the House and the majority leaders. We told them there were many issues they didn't hear about, such as how circumcision deprives children of their bodily autonomy, and that people have a right to a natural, intact body, and about the 4 powers of foreskin: pleasure, protection, lubrication, and connection, and how everyone agrees elective infant circumcision is medically unnecessary. And then how the costs in the fiscal note were understated, both by the way it was calculated and it didn't include costs for botches and revisions. We got their attention. I recall Senator Jill Dewson telling us by equating MGM and FGM, she said, "So what you're telling me is this bill is about providing equal access to genital mutilation. If you hear this bill is moving, please let me know immediately." LD 1858, despite having the full support of the Health Committee, it somehow became buried under 200 other bills in the House. But at one point, 20 bills did come up off the table to be funded. We closely monitored 1858 to make sure this wasn't one of them. During this time, Maine Health was trying to get 1858 off the table as well. But on May 10th, the session officially closed, leaving LD 1858 unloved, unfunded, and as dead as roadkill on a Maine highway. And go back to my prior video. This is exactly what I said our strategy would be. Based on the Maine Department of Health data contained in the fiscal note to this bill, they estimated 1,700 male children would have been cut every year if this law passed. And that's based on a 55% national circumcision rate. I think the rate would be higher in Maine, so defeating this bill likely saved the bodily autonomy of over 2,000 boys every year there. This doesn't include the beneficial carryover effect onto private insurance, because some private plans follow Medicaid. And I also believe hospital solicitations will also reduce where there is less money to be earned, and it helps keep the rate down in states that don't fund Medicaid circs. So if you take the number of babies that will be protected over the next 5 years and divide that by the amount of money we spent, it would come out to just $1.50 a child. Is that cost effective or what? And don't you wish when you were born, you had people like us fighting for you? In New Hampshire, we had two bills, HB 1706 and HB 1683. 1706 focused on mandating circumcision-informed consent, with provisions in the bill that would give parents meaningful information so they can make better choices about circumcision. Most of the people on the Health Committee agreed there needed to be reform of hospital consent forms when it comes to circumcision, but there was disagreement on how to go about doing that. Some wanted obstetricians to give out information during the prenatal period, which is laudable, but how does one enforce that across hundreds of doctors' offices and clinics? Some objected to claiming that we don't have a medical degree and the bill was trying to tell doctors how to practice medicine, and that the medical system was capable of informing patients on the risks and benefits, despite the fact that many people testified they didn't have informed consent and they went on to have bad outcomes, and that the hospitals are paternalistic, evasive, and non-transparent on the issue of informed consent. While I agree one needs a medical degree to diagnose and treat disease and illness, one doesn't need a medical degree to have a valid opinion on issues of ethics, consent, human rights, and bodily autonomy. Because of all of the disagreement on the language, but some consensus on the need, the bill was sent to interim study. What that means is the sponsors can assemble a group of legislators willing to get involved to craft replacement language to overcome objections. And if that doesn't happen, then the bill won't make it. Another option would be for the bill sponsors to talk to the Health Committee, which will have some new members next session, and see if a resubmitted informed consent bill would stand a better chance of passage. Now, with 1683, the bill that would end Medicaid coverage for electively medically unnecessary circumcision in New Hampshire, while still covering medically necessary procedures, which are relatively uncommon, this bill sailed out of the Health Committee, passing 14-7. It then went to the House for passage and failed on the first attempt at 178 to 197. A week later, Representative Emily Phillips moved the bill in a 4-vote process in a second attempt, and the bill passed with the majority on the first 3 motions to put it up for a vote. But ultimately it failed at 191 to 184 on the final vote, or just 4 legislators short of passing the House. But it's not over in New Hampshire. The Health Equality Campaign is continuing to work with Representative Phillips in the State House. We're making a large investment in the state because we feel there are tremendous opportunities there. With our lobbyists, we're building relationships with more legislators and the House leadership. There'll be a new governor up for election, and we'll be meeting with the candidates to determine their commitment to children's bodily autonomy. The bills will likely be reintroduced in the next session, and we'll be coming back even stronger to get them passed on the next go-around. Jumping back to Maine, there is a possibility that a new Medicaid circumcision funding bill will be reintroduced to the Health Committee, and they'll be able to restart the process later this year or in early 2025. If that happens, I have a feeling Maine Health will be driving it. So over the summer and the fall, the Health Quality Campaign will continue to meet with legislators in Maine, so we'll be prepared to meet that challenge. This is what I'm talking about. Real advocacy is being involved in the state houses, stopping laws that would deprive children of their bodily autonomy and trying to pass laws that would protect children. I think we've done enough over the years of just putting information out there, educating people, and then somehow expecting something will happen. We have to be involved with public policy. Doesn't it feel good to make a tangible impact? To point your finger and say, you did that. You stopped that law. You saved 2,000 male children from getting cut this year and every year going forward. And not waiting for others to drive the change, but you're making it happen. Support the Health Quality Campaign so we have the resources we need to drive the change you want. Use the link in the description. And I want to take you into other states over the next year. We're exploring new opportunities to flip states and eliminate financial incentives that are a threat to male bodily autonomy. Almost everyone we speak to in the state houses have told me they never heard of circumcision being a serious issue before, and no one even asked them to consider it. It wasn't until I put it to them that they even thought about it. So despite the articles and media coverage and social media discussions, we need to bring our cause to the State House and present it to the policymakers, or nothing's going to happen. That's the hard truth. Let's do it and not hope and dream. Look at what happens when we open the door to the discussion about bodily autonomy.
Circumcision, medically unnecessary circumcision on infant boys, is the only elective, cosmetic, medically unnecessary procedure that we spend taxpayer money on. So it's not really an issue of poverty versus money. It's an issue of right and wrong and how we treat newborn baby boys.
Do you want to make change happen or just talk about how horrible male circumcision is? If you are ready to drive the change, support the Health Equality Campaign by following the link in the description. We are the only organization that does legislative and political advocacy to protect male bodily autonomy. We've been active in 5 states, and it could be more with your help. Every $1.50 you donate is potentially another boy saved from genital mutilation. We've proven it in Maine. So until next time, my brothers, it's foreskin for the win.